Hello, my name is Mr. Masu, and I'm here to talk to you about a synovial joint known as the coxofemoral joint, otherwise commonly known as the hip joint. The coxofemoral joint is a joint, if you can see, is the joint that connects the rest of your leg to your pelvic girdle, specifically via the femur connecting to the hips. It is comprised of mainly two bones, the femoral head of the femur and the acetibulum within the pelvic girdle, which is more of a cavity for the insertion. They connect via the femoral head going into the insertion point of the acetibulum, and it is then connected via ligaments to attach within the cavity. This allows for a complete third-degree range of motion that allows for it to move within any one of the movement planes. It is primarily connected via three specific ligaments. These are the iliofemoral ligament, which is medial, the pubofemoral ligament, which is anterior, and the ischiofemoral ligament, which is posterior. Not only do they provide stability to the hip, due to how the hip joint is the majority of the stability that the hip gets and also provides, but it also prevents certain movements, such as if your leg is experiencing too much hyperextension or hyperflexion, so that your hips don't perform certain movements that would cause certain damage or even pain if they ended up becoming a reality and being performed. The shape The shape of the coxofemoral joint makes sense for it due to it being a ball and socket joint, similar to that of an action figure, because of the rotation of the spherical femoral head within an insertion and is only tied via ligaments. It allows for a complete third degree range of motion within the sagittal, the frontal or the coronal, and the transverse plane, making it a multi-axial joint. And just like an action figure, this means that there is less friction present whenever the joint moves, but it also allows for there to be less contact when it comes to the bones hitting one another, which allows for such a movement to occur. And that's why the ball and socket joint for the coxofemoral joint makes sense for it to have it. The movement, and what I mean by it can perform all three types of movements, is because it can perform the flexion and extension movements within the sagittal plane, the abduction and adduction within the coronal, and the external and internal rotation within the transverse plane. This, how we have flexion, extension, and if you can see, external rotation and internal rotation, and then abduction and adduction. Flexion being sagittal, abduction coronal, and external rotation being transverse. Thank you.